Hi everyone, I am Dr. Chang. I will be presenting on my literature review of quantitative evaluation of mandibular asymmetry with the use of three-dimensional skeletal imaging techniques. As an introduction to my topic, many organisms around the world exhibit symmetry with variations of asymmetry. The definition of symmetry is the lack of significant differentiation between two halves of the body. Lower facial symmetry is important because of our masticatory performance, facial aesthetics, and psychosocial impacts. The purpose of my literature review is to review currently available literature on assessment of mandibular asymmetry. There are various methods of assessing human studies of mandibular skeletal asymmetry using 3D imaging, and overall we had 30 studies that were reviewed. We want to understand how to diagnose mandibular asymmetry, and this is because we want an accurate diagnosis in order to ensure an optimal treatment. We have several study methodologies, some of which include establishing facial or mandibular symmetry planes, calculating asymmetry between the right and left sides, landmark-based and volumetric approaches, linear and/or angular measurements. Some studies use segmentation and quantitative evaluation of the segmented 3D objects. We also use fully automated computer-executed pipelines, but they aren't currently commercially available. There are also current technology that allows precise quantitative assessment of mandibular asymmetry, and development of automated software is expected to enhance clinical practice. Treatment for facial asymmetry ranges from no intervention needed to orthodontic or surgical intervention. Traditional assessment of mandibular asymmetry relied on clinical evaluation in 2D radiographs, but this may not be as accurate. Clinician evaluation may be influenced by clinician's perception, and 2D imaging has issues like superimposition, magnification, and distortion, making accurate assessment pretty difficult. Advancements in computer technology have improved imaging quality and diagnosis. New methods are being researched currently for quantifying mandibular asymmetry, and this paper focuses on 3D skeletal imaging methods for quantifying mandibular asymmetry. So we had several criteria when selecting our articles to be reviewed. These include human studies, which were diagnosed with skeletal mandibular asymmetry. We utilized 3D imaging. They described methods of diagnosing skeletal mandibular asymmetry. Patients with syndromes or cleft lip or palate were excluded due to confounding factors affecting development of asymmetry. Articles focusing only on soft tissue asymmetry were excluded. Text and opinion papers, narrative reviews, conference abstracts, case reports, and case series were not included in this review. We then had two independent authors review the selected articles to identify other potentially relevant studies for inclusion. The last search was done on August 17, 2023. We screened the titles and abstracts of the identified articles based on the predefined inclusion and exclusion criteria. If eligibility could not be decided by the title or the abstract, the full text of the article was retrieved to determine eligibility. Their decisions related to the initial screenings of the articles were compared, and any disagreements were resolved through discussion. Collected data were then summarized by the two reviewers, which were then reviewed by a third reviewer. The evidence presented was used to address the objectives of the study. And here's a table of the described process that we used to eliminate or include the articles that we reviewed. Here's another example, another one, and here are our results. 935 records were identified by the initial search. After the removal of duplicate studies and the exclusion of the studies based on predefined eligibility criteria, 30 studies were included in the review. Most studies had a retrospective design, 24 out of 30 of the articles, which is about 80%. There were 23 cohort studies, 6 case control studies, and 1 cross-sectional study. Studies were then published from 2006 to 2023. 22 studies included skeletally mature subjects, 2 studies included growing subjects, and 4 studies did not specify the age of the participants. All subjects were diagnosed with clinically significant mandibular asymmetry. Mandibular asymmetry was defined as a clinical deviation of the chin from the midline of the face in the studies. A deviation of the chin of more than 2 millimeters was considered in most studies as a criteria for detection of asymmetry. Clinically significant asymmetry was assessed as a chin deviation from the facial midline exceeding 4 millimeters. Menton was used as a defining point of the chin in most studies for clinical detection, but was not used as a method of quantifying asymmetry upon further evaluation. For the quantitative assessment of mandibular asymmetry, we had 2 steps. 1, establish facial and/or mandibular plane using anatomical landmarks, And in most studies, the anterior cranial-based landmarks were used for the definition of the mid-sagittal plane. Other landmarks were also included. And the second step is to quantify degree of asymmetry by comparing the left and the right sides. Six of the included studies attempted to establish median plane with computer-designed algorithm programs. The aim was to produce more precise midline planes that would lead to more objective mandibular asymmetry assessments. Studies reported that computer algorithm midplane performed better than manually constructed midplanes. And it concluded that computer algorithm midplanes perform better because median reference planes constructed based on facial midline landmarks may confuse mandibular misalignment with structural asymmetry of the mandible, and landmark-based assessments represent symmetry of the landmarks and not symmetry of the entire mandibular structure. Most studies, 17 out of 30, used linear and/or angular measurements based on manually annotated 3D landmarks and midline reference planes. These measurements compare the right and left side distances and/or angles to quantify asymmetry in the mandibular anatomy. Two studies incorporated volumetric assessments alongside linear and/or angular measurements. Color-coded surface distance maps were also utilized using computer software to measure surface distances. 3 studies developed a shape correspondence methodology using geometric morphometrics to quantify asymmetry. This method enables statistical analysis of surface difference between corresponding anatomical areas in different models. Meanwhile, 8 studies used a segmentation approach involving a computer mandibular asymmetry plane and volumetric comparisons, followed by an intuitive assessment of the mandibular similarities in a consecutive sequence of tomographic sections along the coronal plane. And that's something you can see on the figure on the right. Tomographic similarity scan provides an optimized set of graphical presentations for the mandible in 3 segments, the anterior, middle, and posterior segments. It gives a similarity score and the corresponding asymmetric volume. Aim was to identify specific areas of mandibular asymmetry. Most of the segmentation tools are based on image thresholding, which is based on the intensity of the scanned voxels. Each voxel belongs to a specific tissue type, and range therefore varies per subject. Studies state that it is possible to quantify mandibular disproportion with high accuracy using CBCT and CT scans. Detailed analysis of both the positional and morphologic discrepancies between the affected and unaffected side is essential in asymmetric patients. Asymmetry can affect all 3 planes of space, so we have to treatment plan these patients accordingly. Manual identification of a straight mid-sagittal plane based on anatomical landmarks is currently the most frequently used approach. It can be challenging, but it is also operator dependent. In cases of bilateral structural asymmetry in the body of the mandible, the choice of a midline anatomical landmark-based reference plane may result in post-operative residual asymmetry. Computer-constructed midline reference planes have been developed for the definition of an optimal midline reference plane that allows for more objective bilateral comparisons. Another important consideration is the evaluation of the relative asymmetry of the mandible in relation to the facial symmetry. The isolation of the mandible through segmentation procedures provide details of the structural asymmetry of the mandible, but it does not evaluate for the positional component of the asymmetry. Findings from segmentation processes should always be evaluated in combination with a facial symmetry assessment. Segmentation process has been associated with technical problems as well. The simplest way to segment the bone tissue in a CBCT is voxel-based thresholding. In CBCT scans, the density of the voxels is inconsistent throughout the scan, and that causes artifacts that need to be revised manually. These things include metal, dental restorations, patient movement, also affect the thresholding values, and this quality of the segmentation. Some limitations of our review is that we could not access certain databases, decided to focus our review on skeletal 3D imaging, and excluded studies that assessed mandibular asymmetry with soft tissue imaging. Future studies on mandibular asymmetry should also focus on the quantification of the soft tissue changes relative to the skeletal alterations in order to improve the predictability of soft tissue changes and optimize our surgical planning protocols. Integration of automated asymmetry assessment tools in widely used dental imaging software could improve the quality of daily clinical care. And that's all I have for today. Thank you for listening.